Have you ever been cuddling with your dog or cat, feeling their heartbeat against your hand and thought, wait a minute, that felt a little bit weird?
Mm,
Maybe it seemed like it skipped a beat or felt super fast or maybe even surprisingly slow?
yeah, that feeling can definitely make you wonder.
But what if those unusual rhythms are sometimes, well,
Mhm.
completely normal, and then what if they aren't?
Right. That's the key question.
So today we're doing a deep dive into this fascinating, sometimes kind of confusing world of heart rhythms in our pets.
And we're really zeroing in on two specific things vets often talk about:
Mm.
sinus arrhythmia and sinus bradycardia.
Okay.
We've been, digging through some pretty detailed veterinary resources for this one,
Hmm.
clinical notes, study guides, that kind of thing.
The good stuff.
Yeah, the stuff with the real details.
And our goal here is really to unpack what these terms actually mean, figure out why they happen, and most importantly, sort out that difference, between a funny beat that's just a normal quirk and one that might be a sign of something that needs checking out.
Consider this your shortcut to understanding these common findings.
Perfect. So where do we start? Baseline.
Yeah, let's set the stage. What does a normal heartbeat even look like, electrically speaking?
Right. Okay. So the standard is called normal sinus rhythm, and that means the electrical signal, the spark that tells the heart to beat, it starts in the right place.
Exactly. Up in the top right chamber, in the SA node, that's the heart zone pacemaker. And in a normal rhythm, those signals fire off nice and regularly, predictably.
Okay. And on an ECG trace, that translates to,
You see that consistent pattern. There's a little bump. That's the P wave, the atria contracting. And that's followed pretty quickly by the bigger spike, the QRS complex.
which is the ventricles, the main pumps contracting.
Right. And in a normal rhythm, you just get PQRS, 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 consistently spaced. Tick-tock, tick-tock.
Okay, but the speed of that tick-tock, the rate, that varies a lot, doesn't it?
Oh, massively. In dogs, a typical resting rate can be anywhere from, say, 70 to 160 beats per minute.
But it depends on the dog, right?
Totally. Big dogs, especially fit ones, can have really slow resting rates, sometimes down in the 60s, even lower when they're deeply asleep. But tiny dogs, puppies, much faster. Could be up near to 120 even.
And cats.
Cats are usually faster overall. Resting rate typically 120 to 240. But here's an interesting point from the sources. Cats in the vet clinic, they're often pretty stressed.
Yeah, tell me about it.
Right. So their heart rate goes up, which means if you actually find a cat in the clinic with a heart rate below 160, that might actually be a reason to look closer. You'd expect it to be higher just from being there.
That makes sense. Context is everything. And all this rhythm and rate, it's managed by the body's control system.
The autonomic nervous system, yeah.
Yeah.
It's got those two sides constantly playing tug-of-war.
Sympathetic and parasympathetic.
Exactly. Sympathetic is your fight or flight, speeds things up. Parasympathetic, which we often call vagal tone, that's the rest and digest, it slows things down.
And usually when they're just chilling, the vagal tone wins out.
Typically, yeah. At rest, vagal tone is usually dominant.
Okay, so normal rhythm starts in the SA node, regular PQRS pattern, rate varies but within expected ranges, balanced by the nervous system.
Got it. Now we can talk about the variations. Let's start with sinus arrhythmia.
Okay, sinus arrhythmia, or SA, still starts in the right place, the SA node.
Yep, the impulse still originates there, and the P waves and QRS complexes themselves look normal on the ECG.
Yeah.
The difference is the timing.
It's irregular.
It's irregular.
Yeah.
The time between beats, the RR interval, isn't constant. The sources define it as like more than a 10% variation or a specific time difference between beats, about 0.12 seconds in dogs, 0.10 in cats.
And the most common kind is linked to breathing.
Right. Respiratory sinus arrhythmia, RSA. And this is where it gets really cool, I think.
How so?
Because that irregularity, it's directly tied to breathing. Remember that vagal tone, the slowing down nerve?
Yeah.
It actually fluctuates with every single breath.
So when they breathe in.
When they inhale, the vagal tone dips slightly, less braking action. So the heart speeds up a tiny bit, the RR interval gets shorter. Then when they breathe out, exhale, vagal tone increases again, more braking. And the heart slows down a bit. The RR interval gets longer.
Wow. So it's like their heart speeds up and slows down with every breath cycle.
Exactly. It's driven by reflexes from stretch receptors in the lungs, pressure sensors in the heart, all feeding back and tweaking that vagal nerve activity.
That's pretty neat. And the ECG reflects this.
Yep. Apart from that rhythmic speeding up and slowing down that matches the breathing, everything else looks like normal sinus rhythm. You still see a P before every QRS, QRS after every P, and the timing between the P and QRS, the PR interval, stays constant.
Okay. And wasn't there something about a wandering pacemaker, too?
Yeah, good point.
Yeah.
That often goes hand in hand with SA. It's basically the exact spot within the SA node where the signal starts, just shifts slightly because of those changing vagal influences.
And you see that on the ECG, how?
You might see subtle little changes in the shape of the P wave from beat to beat. It's just another sign of that dynamic vagal control happening.
Okay, so defined, linked to breathing, ECG looks mostly normal.
Yeah.
But the really key thing, especially for owners, is this normal?
Okay, yeah, species spotlight time. Because this rhythm, RSA, is super common and considered completely normal and physiological in healthy resting dogs.
Like really normal.
Really normal. Especially noticeable in dogs with naturally higher vagal tone. Think brachycephalics, bulldogs, pugs, shih tzus, boxers.
The ones with the smushed faces?
Right. Their airway conformation can actually increase that vagal tone.
Yeah.
So honestly, if you have a calm dog resting and they don't have some sinus arrhythmia, that might actually be more unusual.
Oh.
It might suggest their sympathetic system is a bit more active than you'd expect for a resting dog, or maybe there's some underlying heart issue that's kind of overriding or masking that normal vagal effect.
So if my dog's asleep on the couch and I feel their pulse kind of going unevenly, speeding up and slowing down, that's probably just dog stuff.
Very likely just normal dog stuff.
Yeah.
Speeding up slightly with the inhale, slowing with the exhale.
Okay. But cats are different.
Cats are different. You almost never detect RSA in a cat at the vet clinic.
Because they're stressed out.
Exactly. The stress cranks up their sympathetic fight or flight system, and that just blows the subtle vagal fluctuations out of the water.
So if you do find it in a cat in the clinic,
It might be a clue. It could suggest something else is going on that's abnormally increasing their vagal tone. Although the sources do say it can be normal in a truly deeply relaxed cat, like maybe at home, snoozing in a sunbeam.
Amy breeds more likely.
Maybe Persians and Himalayans, potentially. But generally, it's uncommon to find in cats, especially in a clinic setting.
Okay, so clinically speaking, for the typical dog with RSA, is it harmful? Does it cause problems?
Generally, no. The usual respiratory kind in dogs,
Yeah.
not clinically significant, not harmful, doesn't cause symptoms.
Are there exceptions?
The only time it could potentially cause an issue is if the pauses between beats become really, really long, like multiple seconds long, which is rare for typical RSA.
And if that happened?
Well, if the pauses are that long, especially if the overall heart rate is already quite slow, then maybe you could get a temporary drop in blood flow to the brain. That might cause some weakness or even fainting, what we call syncope. But again, that's not your standard RSA picture.
And the non-respiratory kinds?
Those are less common and more likely to be linked to some underlying disease that's messing with vagal tone.
So, main cause in dogs. Normal breathing physiology. Other things that can increase vagal tone and maybe cause or worsen SA could be what?
Things like high pressure inside the skull, significant GI issues like bloat or severe vomitings, some respiratory diseases, certain toxins, even things vets sometimes do, like putting gentle pressure on the eyes or massaging the neck area over the carotid sinus, can make it more obvious by stimulating the vagus nerve.
And diagnosing it. Listening isn't enough.
Listening can make you suspicious because it sounds irregular, but it can be hard to tell why it's irregular just by ear, and ECG is really essential.
To confirm it's SA.
Exactly. You see the P waves and QRS are normal. It's just the timing that's variable.
Yeah.
And crucially, it helps rule out other arrhythmias that are problems, like beats coming from the wrong place or more serious syndromes like sick sinus syndrome.
Okay, let's unpack the treatment question then. If my vet finds sinus arrhythmia, what happens next?
For the vast majority of cases, the normal respiratory kind, nothing. No treatment is needed. It's benign.
And if it is causing symptoms, which is rare, or it's linked to something else?
Then the focus is entirely on treating the underlying cause. You don't treat the arrhythmia itself, you treat the disease that's causing the increased vagal tone, like the GI problem or the high intracranial pressure.
Got it. So SA in dogs, usually normal. SA in cats, less common, might warrant a look if found in clinic. Treatment, usually none needed, unless treating an underlying cause.
That sums it up pretty well.
All right, let's shift gears then to the other rhythm. Sinus bradycardia, SB. This one sounds simpler, just slow.
In terms of rhythm, it usually is simpler. Sinus bradycardia is typically a regular rhythm, unlike SA. The issue isn't irregular timing, it's that the rate itself is just slower than you'd expect.
Slower than normal for that specific animal.
Exactly. Slower than expected for their species, age, size, current activity level. On the ECG, you still see the normal P wave followed by a normal QRS complex, just spaced further apart. The gap between beats is longer.
And what counts as too slow? You mentioned thresholds earlier.
Yeah, the general ballpark figures are maybe less than 60 or 70 beats per minute in dogs and less than maybe 100 or 120 in cats in the clinic setting. But again, huge emphasis on context.
Right, the sleeping Great Dane at 40 BPM might be fine.
Totally fine. But a tiny puppy under anesthesia at 70 BPM, that could be a serious concern. It's all relative.
Okay, so why would a heart just slow down like that, below the expected rate?
It can be totally harmless,
Yeah.
physiological. Think of highly conditioned athletes, their resting heart rates are often lower. Or just during deep sleep or profound relaxation, high vagal tone again.
So the rest and digest system is just really dominant.
Right. Or conversely, maybe the fight or flight sympathetic system is suppressed for some reason.
Yeah.
Or sometimes the problem is actually within the SA node itself.
Like the pacemaker is just sluggish.
Kind of, yeah. Intrinsically not firing as fast as it should. The cellular mechanisms are complex, involving ion channels like that funny channel we talked about, which helps set the pace. Disruptions there can slow things down.
And what kind of disruptions?
All sorts. Changes in blood chemistry, electrolytes, pH, low thyroid hormone, increased pressure in the head, certain drugs or toxins. And it can definitely be part of sick sinus syndrome.
Okay, so clinically, does a slow heart rate always cause problems?
Not always. If it's mild or if it's just a physiological adaptation like in an athlete, or maybe caused by a sedative drug but the animal is otherwise stable, it might be completely asymptomatic, no signs at all.
But if it gets slow enough?
Then you start seeing issues. If the heart beats so slowly that it can't pump enough blood around the body to meet its needs, what we call cardiac output dropping, that's when symptoms appear.
What kind of symptoms should owners look out for?
The common ones are things like lethargy, just being really tired, maybe weakness, getting worn out easily with exercise.
Makes sense. Not enough oxygen getting around.
Exactly. You might notice signs of poor circulation, like cold ears or paws. Sometimes hypothermia is linked. And if the brain isn't getting consistent blood flow because the heart's too slow, you can see fainting, syncope, or maybe episodes of just stumbling or weakness.
Any other signs?
Seizures are pretty rare,
Yeah.
but possible if it's really severe and prolonged. Maybe even signs of congestive heart failure eventually in some cases.
Wow. Okay, so the list of potential causes for SB sounds like it's pretty extensive.
It really is. We can try to group them, though. First, you have the physiological causes, mostly driven by that high vagal tone.
Like the athlete, the sleeping dog.
Yep. Also, brachycephalic dogs struggling a bit to breathe. Severe GI upset like vomiting or bloat, significant pain, even stimulating the eye can trigger a reflex, the oculocardiac reflex that slows the heart. High intracranial pressure, being severely cold, hypothermia. Even the body's reflex to slow the heart if blood pressure suddenly spikes. And some breeds just naturally run slower.
Okay, so that's the normal or reflex group. Then you mentioned drugs.
Right. Pharmacological causes. This is a big one in vet med. Lots of sedatives and anesthetics do this. Alpha-2 agonists like dexmedetomidine, opioids, propofol, the inhalant gases.
Things commonly used for procedures.
Very common. Also some heart medications themselves like beta blockers, calcium channel blockers, digoxin, even high doses of IV steroids sometimes.
Okay. And then the third category, the diseases.
Yeah, the pathological or systemic causes. Hypothyroidism, low thyroid is a classic one. Slows everything down.
And electrolyte.
Electrolytes are critical, especially hyperkalemia, high potassium. That's a major red flag. It can cause severe bradycardia, mess up the ECG pattern significantly, even make the P waves disappear, leading to something called atrial standstill. Really dangerous.
So potassium is key to check. Others?
Less commonly, really severe low potassium or issues with calcium or magnesium can play a role.
What else falls under pathological?
Actual diseases of the heart muscle or the SA node itself, like myocarditis inflammation, certain cardiomyopathies, sick sinus syndrome, the constant bradycardia form, being really debilitated from chronic illness, cachexia, very rarely maybe a tumor pressing on the SA node area, and things like severe lack of oxygen, hypoxemia, or low blood sugar, hypoglycemia.
It's quite a list.
It is. It highlights how many different things can impact the heart's basic rhythm.
So given all those possibilities, how does a vet sort it out? How do you know if the slow rate is just, say, a relaxed dog versus something serious like hyperkalemia or SSS?
Well, it starts with the physical exam, feeling that slow, usually regular pulse, listening. But the absolutely essential tool is the ECG.
Again, the ECG is key. What does it show?
It confirms, first off, that it is sinus bradycardia, meaning you still see a normal P wave before every normal QRS complex that is just happening slowly. And crucially, it helps differentiate it from other causes of a slow heart rate.
Like what? What else looks slow?
Things like AV block, where the signal gets stuck traveling from the top chambers to the bottom. On the ECG, you'd see P waves that don't have a QRS following them. Or that atrial standstill we mentioned with hyperkalemia there. You often see slow, wide QRS complexes, but no clear P waves at all. The ECG pattern tells the story.
Okay. What if the signs, like fainting, only happen occasionally? The ECG in the clinic might be normal then.
That's where a Holter monitor comes in. It's basically a portable ECG the pet wears, usually for 24 hours, while they're at home doing their normal thing.
So you can catch it in the act.
Exactly. You can see if they have episodes of severe bradycardia, and importantly, if those episodes line up with when they're having symptoms like weakness or fainting. It helps distinguish if the bradycardia is physiological, like only during sleep, or pathological, happening when they shouldn't be that slow.
The sources also mentioned something called the atropine response test, or RT. Tell me about that.
The RT. Yeah, this is a really useful diagnostic test, specifically for bradycardia. Its main job is to help figure out why the heart is slow. Is it mostly because of too much vagal tone holding it back? Or is it because the SA node itself is just intrinsically sick or damaged?
How does it help tell the difference?
So you start with a baseline ECG, measure the heart rate, then you give a dose of atropine, that's a drug that blocks the vagus nerve's slowing effect.
Remove the brake.
Removes the brake, exactly. You give it usually IV or IM, wait a specific amount of time, like 10-15 minutes for IV, and then you check the ECG again and see how much the heart rate increased.
And the result tells you.
If the heart rate speeds up significantly, say, increases by more than 50% or gets up into a normal range, it strongly suggests that high vagal tone was the main culprit. The pacemaker can go faster. It was just being suppressed.
Okay, but if it doesn't speed up much?
If there's little or no increase in heart rate after the atropine, that points towards intrinsic SA node disease. The pacemaker itself is just not capable of firing faster, even with the vagal brake removed.
That's a pretty clear distinction.
Yeah.
Any pitfalls with the test? I think you mentioned low doses earlier.
Yeah, that's an important point. Giving too low a dose of atropine can sometimes paradoxically make the bradycardia worse for a bit, possibly due to some central effects before the peripheral blocking kicks in. So using the proper recommended dose is important.
Okay, so ECG, maybe Holter, maybe RAT. What other tests might be needed?
It really depends on what the vet suspects, based on the initial findings. Blood tests are almost always done. Checking electrolytes, especially potassium, is critical. A thyroid panel if hypothyroidism is suspected. Maybe a drug level if the pet's on something like digoxin. Could be. Chest x-rays, an echocardiogram, heart ultrasound, to look at the heart structure and function. Maybe abdominal x-rays or ultrasound if there's a suspicion of GI disease causing high vagal tone. Possibly scoping the throat if airway issues seem likely.
All aimed at finding that underlying cause and ruling out other slow rhythms.
Precisely. Differentiating SB from AV block or atrial standstill is key, as the treatment and prognosis can be very different.
Okay, makes sense. So diagnostic's done. We know it's sinus bradycardia. Let's talk treatment and prognosis. What's the general approach?
The number one principle always is, if it's asymptomatic sinus arrhythmia or just physiological sinus bradycardia, you generally don't treat it.
Like the athletic dog or the sleeping cat?
Right. But if the animal is showing clinical signs because of the bradycardia weakness, fainting, the absolute first step is always to identify and fix the underlying cause, if you can.
So stop the offending drug, treat the high potassium, manage the thyroid disease, warm the patient up, fix the bloat.
Exactly. Treat the primary problem. Now, if you can't fully fix the underlying cause, or if the problem is intrinsic SA node disease, like SSS, and it's causing symptoms, then you might consider medical management.
What kind of medications?
There are some oral drugs vets sometimes try, like propantolone, terbutaline, or theophylline. But honestly, the sources suggest their effectiveness can be pretty limited, and they can have side effects. They're trying to stimulate the heart rate chemically.
What about those drugs like atropine? You said they block the vagus nerve?
Right, atropine and a similar one called glycopyrrolate. They are powerful anticholinergics. They're mainly used for acute, severe bradycardia, like an emergency situation, or maybe right before or during anesthesia to boost the rate quickly.
But not for long-term use.
Generally not.
Yeah.
Because they block parasympathetic effects all over the body, you get side effects like dry mouth, potentially constipation, urinary issues, pupil dilation. Not ideal for daily chronic medication.
And you mentioned some precautions with using them.
Yes, definitely. For instance, if an animal is bradycardic during anesthesia because they're hypothermic or have severe acidosis, the slow heart rate might actually be protective, and overriding it could be harmful.
And the warning about using them in sick sinus syndrome.
Ah, yeah, that's a big one. In SSS, the main pacemaker is failing, and the heart might be relying on slower escape beats from lower down to keep going. If you give atropine and block those escape rhythms too, you could potentially cause the heart to stop completely asystole. So extreme caution is needed there. Glycopyrrolate is sometimes preferred as it might have a longer duration and potentially fewer ventricular side effects.
Okay, so if the underlying cause is treated but symptoms persist and oral meds aren't cutting it or have bad side effects, what's the definitive solution for persistent symptomatic SB, especially from SSS?
Pacemaker implantation. That's the gold standard.
A surgical procedure to put in an artificial pacemaker.
Exactly. For pets with persistent symptomatic bradycardia due to intrinsic SA node disease, like SSS, where the heart just can't maintain an adequate rate on its own, a pacemaker provides reliable, long-term rate support. It basically takes over the job of the SA node.
And that resolves the symptoms like fainting.
Usually very effectively, yes. It prevents those dangerously slow rates.
What about the prognosis overall for these conditions?
For straightforward sinus arrhythmia, excellent. It's normal. For physiological or reversible sinus bradycardia, also excellent once you fix the underlying cause.
But for the pathological kind, like SSS causing fainting?
Without effective treatment, the prognosis is more guarded. The symptoms can be life-limiting. But with a pacemaker, the prognosis for resolving the clinical signs and giving the pet a good quality of life is often excellent. Medical therapy alone, for comparison, is often much less successful long-term.
So that pacemaker can really be a game changer.
Absolutely.
And clear communication with the owner throughout this process sounds crucial.
Oh, absolutely vital. Making sure owners understand the difference between something benign, like RSA, and a serious issue like symptomatic SB. Explaining why certain tests are needed. Discussing the options medical management versus pacemaker, including the pros, cons, costs, and realistic expectations for each. It's key.
And follow-up care, too, presumably.
Definitely. If medications are used, adherence is important, and owners need to know what signs of trouble to watch for. If a pacemaker is placed, there are follow-up checks needed for that, too.
Okay, one specific area we should touch on is anesthesia. Bradycardia sounds like it would be a particular concern there.
Yes, a very important consideration. Pets with pre-existing bradycardia, especially if it's pathological or they have SSS, are definitely at higher risk under anesthesia.
Because the anesthetic drugs themselves can slow the heart rate further.
Exactly. Many common anesthetic agents have a depressive effect on heart rate, so you're starting from a lower baseline and potentially pushing it even lower.
So the choice of drugs is really critical.
Crucial. The whole anesthetic plan has to be tailored. You want to try and avoid or minimize drugs known for causing significant bradycardia, like maybe using lower doses of alpha-2s or opioids, or choosing alternative agents if possible.
Would they use something like glycopyrrolate beforehand?
Sometimes, yes. Premedication with an anticholinergic like glycopyrrolate or atropine might be part of the plan, especially if high vagal tone is suspected as a contributor, or just as a precaution to help maintain heart rate. Glycopyrrolate might be preferred sometimes for its duration or side effect profile.
And during the procedure, monitoring must be intense.
Absolutely non-negotiable. Continuous ECG monitoring throughout the entire anesthetic period is essential. Close monitoring of blood pressure is also critical.
And being ready to intervene.
Yes, the team needs to be fully prepared to treat severe bradycardia if it occurs, having emergency drugs like atropine or maybe isoproterenol ready to go. In some specialized settings, they might even have capability for temporary cardiac pacing.
Sounds like involving a specialist might be a good idea for these cases.
For pets with known severe bradycardia or confirmed sick sinus syndrome, getting a veterinary cardiology specialist involved in planning the anesthesia is definitely highly recommended.
Wow. Okay, we've covered a lot of ground here. From the basic normal rhythm, through that often normal irregularity of sinus arrhythmia, and then into all the complexities of sinus bradycardia, the causes, the signs, the diagnosis, the treatment.
It's definitely a journey through the heart's electrical system.
And I think for me, the biggest takeaway is that not every blip or slow beat is a disaster, right? Especially that sinus arrhythmia in dogs feeling that unevenness when they're relaxed is often just normal dog physiology.
Exactly. That's such a key point. The real concern flags go up when the heart rate is genuinely pathologically slow. And it's actually causing problems for the animal, like weakness or fainting.
It really highlights how interconnected everything is, doesn't it? How just breathing or feeling pain or being asleep can directly influence something as fundamental as the heartbeat.
It's an amazing orchestration, really. That constant balancing act by the nervous system in response to everything the body is experiencing.
A complex dance.
Hmm.
So for any pet owner listening, if you have noticed something that feels off about your pet's heartbeat, what's the bottom line?
The single most important thing is always talk to your vet.
Yeah, don't panic, but don't ignore it either.
Right. Let them do an exam, listen carefully. They can help figure out if it's just a normal variation for your pet or if something like an ECG is needed to investigate further and see if any action is required.
And hopefully this deep dive gives you a bit more context and understanding for that conversation.
That's the goal, to empower you with a bit more knowledge about what might be going on.
Excellent. Well, thanks for unpacking all that. It's fascinating stuff.
Absolutely. Glad we could dive into it.